When you see a victim with life-threatening conditions, immediately summon EMS. As we approach the victim, we first need to size up the scene by checking for any potential hazards that may cause harm. After checking to make sure your surroundings are safe, begin to approach the victim. Try to determine what caused the injury or nature of the illness. Now, before you begin your assessment, if possible, apply any PPE that may be available, such as gloves. Now, you are ready to begin a primary assessment of the victim. To determine if your victim is unresponsive, try asking them if they are okay. If you still do not receive a response, let's try using the shout, tap, shout sequence by touching the victim's shoulder while asking if they are okay. Open the victim's airway by tilting their chin upwards. Now, place your ear over the victim's mouth and nose and listen for breathing. In addition, place 2 fingers in the middle of the victim's throat, then slide them into the groove at the victim's neck and press lightly. While you are in this process, check if the chest is rising and falling, as this will also indicate signs of breathing. Keep in mind, checking for breathing and a pulse should last at least 5 seconds, but no longer than 10.
Now, if you determine from your primary assessment that your victim is not breathing, you must give ventilations in order to help them breathe. Usually, trained professionals such as lifeguards will use pocket masks in order to give ventilations. However, in many cases, you will most likely not be carrying a pocket mask. As a substitute, you should place part of your shirt over the victim's mouth and perform 2 mouth-to-mouth ventilations. Each ventilation should last about 1 second, clearly making the chest rise. Pause between ventilations to let the exhaled air escape. If the chest does not seem to rise, try retilting the victim's head and try again.
As a special consideration, if and when the victim is unresponsive and begins to vomit, the airway could possibly become blocked. Roll the victim towards you on their side into the recovery position and wait for the vomiting to stop. If you're wearing gloves, try to remove any excess vomit or particles from the mouth. Once the vomiting has stopped, continue to provide care.
Going back to the primary assessment, you will perform CPR if the victim is not breathing and does not have a pulse. To start, make sure the victim is on a firm, flat surface. Make sure the victim's chest is exposed in order to visualize chest recoil. Next, you will begin by giving 30 chest compressions. In order for these compressions to be effective, position yourself next to the victim's upper chest with your knees shoulder width apart. Place the heel of one hand in the center of the chest on the lower half of the victim's sternum. For an adult, you will need to compress the chest at least 2 inches deep, but no more than 2.4 inches. Allow the chest to recoil between each compression. Your compressions must be at a rate of at least 100 beats per minute, but no more than 120. Count out loud to keep an even pace. After the 30 chest compressions are complete, you may now give your 2 ventilations. Continue this cycle of 30 compressions and 2 ventilations until an automated external defibrillator or EMS arrives.